video is going to work because I'm not behind the camera. I'm sort of just, the camera's just sort of sitting there. I wanted to show you all something that I was dying to know, 10 years ago when I started to look up this surgery. I started to look it up in 2000 actually. And if I found anything at all, which was very far and few in between, but was just, an aerial shot of someone's foot before and after. But it didn't tell me much more than that. There was nothing on procedure, nothing on the post-op, how things felt, how things fit, the time frame, nothing, or even how the toe functions afterwards. I'm sure all of you already know that no doctor will promise you that you'll have the flexibility in your toe after surgery. The doctors I spoke to all sort of stay away from that subject when you ask. I mean, my doctors, both doctors that I asked, both said to me, well, you're going to lose most of that when I asked about being able to crimp my toes. But I'm in the 13th week now, and I'm doing partial weight bearing with my crutches. So as you can see, as I lift my foot, you can see, and I've been practicing to do this. I couldn't just bend my foot upward like this and leave my toes on the ground. I have been practicing, and doing physical therapy here at home, and I now have a very good range of motion. But you can see that toe, the fourth toe for me on my left foot, the profile is still quite low, and this is what it looks like and how it functions. And I have done a few of these videos just for myself because I wanted to see. And one thing that I realistically have to say is that people are looking at my feet, or I'm looking at my foot from an aerial view, in a flip-flop. No one is going to be as low as this camera is. So take that into consideration. The camera's on the floor right next to my toe. And people just don't see feet that way. So keep that in consideration. It seems like it's very stiff and that it's very low. But your view actually changes from up here, from what I can see. But I just wanted to show you what it looks like and how things move. I can't exactly tell you how it feels. It does feel pretty tight. It feels like work, when I'm doing this. I guess all my tendons are sort of out of practice, and I don't want to make this a long video, so I'll just stop talking and just show you the range of motion. This way I can make this a short video. But there you have it. That's the movement on this foot, and hopefully in a couple of weeks I'll be able to not have to use my crutches, and I'm home where it's safe. So normally doctor recommends that I always be with my boot when I'm on my crutches, of course, because if you fall, you're protected by your boot. So I'm just doing this as a show and tell. So there you have it, a nice close look at what it looks like. Okay, if you have had surgery and you're not at this point just yet, I just want to encourage you to follow your doctor's orders, keep the therapy going, and don't worry, you're going to get there. It'll come. It gets better, and you will get there. So be encouraged. Okay, bye bye.